Women's Day looks at the courage of South African women during the apartheid era. And let's address now a very current issue. There are calls this Women's Day for gender justice when it comes to vaccines and the current rollout. Gender Links and other women's rights groups have called on President Ramaphosa to provide sex disaggregated data on the vaccine rollout. They say the vaccine rollout cannot be monitored effectively without information on the uptake by women, for example, men, the LGBTIQ community, people living with disabilities and other demographics. To discuss, we're joined by Gender and Governance Associate at Gender Links, that's Susan Tolmay. Ms. Tolmay, thank you for being with us. Let's start with the gender problem that we do know exists before we even look at vaccines. South Africa is one of the few countries in the world in which women constitute the majority of those getting infected and dying of COVID-19. Firstly, are you concerned? Do you know what accounts for that?
Well, it is an anomaly. If you look at the globe, originally more men were being infected and were also being hospitalized. So there was a definite shift there or a difference. Globally, it has now changed, so it's almost on equal footing. South Africa has always been more women being infected than men. And now, which is a little bit alarming, they're now dying at higher rates than men as well, because previously they were more infected, but fewer hospitalizations and fewer deaths. But now that's shifting. So it is a concern. I think that our socioeconomic situation, can be a contributing factor to that. We have, globally, women are 70% of healthcare workers. So, there is a difference in how the pandemic is affecting women and men, both socioeconomically, but as well as biologically.
Yeah. So all the more reason for women to get vaccinated. The data that shows this bias available for cases, but we don't have sex data when it comes to vaccines. Why in the first place?
I've been doing a lot of research around vaccine justice. And we know with the data that's available, we know that there's very big disparity between vaccine rollouts in the north and rollouts in the south. So there's a lot of data that's available in terms of how many people get vaccinated every day, but none of that data is disaggregated by sex. So we don't know who's getting vaccinated, what regions they are. Ages, will become more of an issue when it's opened up to everyone. But those are important demographics for us to really understand how the rollout is taking place and to ensure that it's happening in a fair and equitable way.
All right, so this call is for the data to be collected firstly on male versus female. Has government responded to that yet?
Not that I'm aware of. I know that we were delivering the vaccine, the petition today. I haven't heard anything back. I don't think that it's a big leap from the amount of, South Africa is very good with the data. We can get up-to-date data every day on the general numbers in which provinces, who's getting vaccinated. We just don't know whether it's men or women, and whether there's any kind of disparity there, which is something that we really do need to keep an eye on, considering the inequality that does exist in the country.
Yeah. And I think you're also concerned about barriers for other groups, migrant women, people with disabilities, the LGBTIQ community, sex workers. I can understand people living in rural areas, but surely there's no barrier, say, for a sex worker. What could that be?
Well, we know that certain groups, particularly sex workers, LGBT communities, don't always have a good experience when they seek mental health care. Healthcare. When they go to clinics, it's about having people within those clinics understand the different groups and the different communities and why it's important for everyone to be vaccinated and for everyone to have equal access. So specific campaigns around around migrants, sex workers, LGBT communities. That all needs to be part of the vaccine rollout plan.
Yeah.
And as I say, the government has done well so far. We just want a little bit more of the detail.
Hasn't the bird flown to some extent? I got a vaccine. I wasn't asked if I have a disability, for example, if I'm a member of the LGBTIQ community. And when some people say, actually, I'd like to keep that private.
Yes, I mean, that does raise those questions. I wish I could now remember what happened when I went and registered for vaccine, because that data should be available. I mean, we should be gathering it, whether you're male, female, or gender non-conforming. And a lot of organizations and countries are changing so that data can be gathered. As I say, I can't remember whether I entered that data, but it should, as a matter of course, be being collected, because we know that these things don't affect women, men, and gender non-conforming people in the same way.
All right, and then finally, there are calls for also the under 35s to get vaccines as soon as possible, for those with comorbidities to be prioritized. We've heard that call often. Is that just general what you think is best, or do you believe that women would benefit as well?
Well, I mean, I think that it benefits everyone to be vaccinated and for everyone to get vaccinated. And, I think that the rollout at the moment is going quite well. I don't see that there should be any reason why young people can't be included within that. So I think that it will benefit everyone equally.
All right. Thank you for your time tonight. Gender and Governance Associate at Gender Links, Susan Tolmay.